Okay, so this video will be on the axial skeleton. We're going to begin. Someday I'll learn how to do this. With the skull. This is the most superior part of our axial skeleton. You'll notice that the skull contains the facial bones and the cranium. The cranium is the vault, V, that's a V, A-U-L. Is the vault for the brain. Well, the facial bones, where am I? No. The facial bones here, these are for, they give the structure to your face so that it looks the way it looks. And it looks the way it looks to accommodate the eyes, the nose, the mouth, the ears. These are very fine bones, very fine structures. There's a lot of detail, but I don't ask you for a lot of detail. You need big sockets for your eyes. You need a big opening, a large opening for your nasal cavities. You need a large opening for your airway and your food. And it's very complex. And we do have, well, let's go on. So below the, or inferior to, where am I? Sorry. Inferior to the skull, we have a bone right here called the hyoid bone. We'll get to that. Here's your vertebral column. That gives you structure so you can stand up. This is the sacrum. This is your pelvis here. These are your hip joints. Femur, tibia, fibula, tibia, fibula. But we're going to concentrate on what's in green here. So this will include the thorax. And the thorax is the ribs. We have 12 pair of ribs, so we have 24 ribs. And the sternum. Right here, protects your heart. And then the vertebral column. Okay? So moving on to the skull. What is on this PowerPoint? So this video, I'm going to give you the same PowerPoint. These are all the structures that you will need to know, the ones that are labeled on these PowerPoints. So don't go to your book and start memorizing every single thing in those pictures. Just go to these, because these you'll be tested on real bones. So the real practice will come when we start looking at the real bones. So the bones, oh sorry. So the frontal bone is your forehead. And the nasal bone can't do is a paired bone. So it's like the bridge of your nose, and then the actual shape of your nose, you know, comes out like this with your nostrils. This is all cartilage out here. That's way too big. We have a lacrimal bone right here. Lacrimal means tear because there's a tear duct down here. Here's the ethmoid bone. You only see a portion of it. You can look at the actual bone in your book. It's a tissue-like bone, and it's very, very irregular. Right here is the zygomatic bone. Then this is the zygomatic arch of the zygomatic bone. Over here is the sphenoid bone, and over here is the temporal bone. And this is a paired bone, and the sphenoid bone is one bone, but it goes directly across and behind the eyes. And then the bone that holds, no, I can't do this. The upper teeth is the maxilla. So again, from the anterior view, I can't see where my pointer is. Maybe if I do this. There, now I can see it. So the frontal bone You get a better picture of it in your book when you can see the bone by itself, but it's your forehead. The nasal bone again is the bridge of your nose, the zygomatic, and these are the nasal concha. This is the inferior. There's inferior, there's also a middle and a superior. And this is the septum. See, that's deviated. And this is the vomer bone right here. And then the mandible is a separate bone, and it has these joints up here, the temporomandibular joints, or the TMJ joints. Okay. So if we open up the skull, take the top off the calvarium, we're going to see right here. This is the cribriform plate of the ethmoid bone. And then there's a ridge that comes towards you, up superiorwards. And it's called the crista galli. And then you'll see these little holes in here. Okay? And this is where the nerves that go into your nose, which receive chemical signals, molecular signals, for smell, for the sense of smell. So this whole structure right here is to support the sense of smell. Here, remember that sphenoid bone? It looks sort of like a big bat when you take it out. It goes from one side of the skull to the other. Okay, sphenoid bone. Sphenoid. PH is usually makes the sound of an F. Right here is the sella turcica. The pituitary gland sits right here. So this is very important. And right here, coming from this spot and this spot, are the optic nerves, and they come like this and they cross over. So if you have a pituitary tumor, it can put pressure on these optic nerves and cause temporary blindness. And to remove cancerous pituitary gland, they go through your eye socket, because your eye is right here. Right here. Okay, so this right here is the occipital bone. This is too close a view. We can see it in a different view. These are the temporal bones by your temples, superior to your ears. And then down here is a big hole called the foramen magnum. Foramen magnum. There's a better view. Here again, now you see how large the frontal bone is? Like this. But all we see from the outside, is this part, our forehead. Here's the crista galli again. Here's the cribriform plate. Here's that sphenoid bone. Here's the sella turcica, the foramen magnum, the temporal bones, and the occipital bone. The occipital bone is all of this. Okay? It's huge. And it's the back of your head. So from underneath, looking upward, here again is your foramen magnum. This is where the spinal cord exits or enters. Spinal cord. Inferior to the foramen magnum, it's called the spinal cord. As soon as it passes the foramen magnum, now it's the brain stem. So you're going to notice these two huge flattened protuberances right here. These are called the occipital condyles. Okay, here's the occipital bone here. All this is occipital bone. Here's the vomer bone that I pointed out in that first slide. Right here you can't get a good view of it. It's a bony process called the mastoid process. And then anterior to that, you're going to find these spiny processes, and these are called, this is called the styloid process. And you need to know this. Okay, palatine bone. This is the maxilla right here. This is a great test question. This is the palatine bone back here. It's a small portion of the entire palate. You might think that your palate is the palatine bone, but no. The hard palate, you can feel it with your tongue, the hard part of the roof of your mouth, is the palatine process of the maxillary bone. And here is the zygomatic process. It begins at the temporal bone. Oops. Temporal. And it continues into the zygomatic bone. Okay. So you have the zygomatic process of the zygomatic bone, and then you have the zygomatic process of the temporal bone, and they meet, you know, somewhere, depending on who it is. Everyone is a little bit different. There's a suture here, and you'll find it. Okay, from lateral view, again, the mandible is a separate bone, and it has an articulation right here, the TMJ. Here's your occipital bone. Right. It's hard, it's thick, it's irregular. You know, you get knocked on the back of the head a lot, so that needs to be very strong. The temporal bone, we have a pair of them, one on each side. Here's the temporal bone here. See? Here's the zygomatic process of the temporal bone, and here's the zygomatic process of the zygomatic bone. Here's the edge of the sphenoid bone. Remember, that goes all the way across. Above the temporal bone is the parietal bone, and there are two of those. Here's the frontal bone. Here's that lacrimal bone again, the nasal bone, the maxilla, and the mandible. So we're going to look at a few sutures here. This is the coronal suture because it's on the coronal plane. This is where the plates of the skull grow together. You know, when you're bone, your head is soft. It has the you know, those soft plates, and as they grow together, they make these suture lines. So this is the coronal suture. This is the squamous suture because it looks like a squamous cell. Squamous suture. Here again is your zygomatic process. This is the lambdoid suture here, kind of irregular. Here's the mastoid. Here's the styloid. I want you to know styloid. It's for muscle attachments. On the, now you remember this mental process? That mental spot that you learned in chapter 1? On the mandible, you have this angle here. So you have a vertical part, or most people do. Then you have a more horizontal part. And then this part is called the angle. And this is actually the bone, and the extension up here going superiorwards is called the ramus of the mandible. We'll see the mandible later. This is a better picture of the lambdoid suture between the occipital bone and the parietal bones. And then the sagittal suture is going to be on the sagittal line of the body. Again, sagittal suture, parietal bones, frontal bone, and the coronal suture. So the coronal is on the coronal plane, and sagittal is on the sagittal plane. And the lambdoid is here, and then the squamous are more to the sides. If we look underneath the maxilla, you can see the maxillary bone here. This is your hard palate. Okay? And then right here, where you see this line here, this is the palatine bone. It's very irregular in shape. You can see where it goes, like this. And then you have the vomer bone. And you can feel it just at the base of your nose. I showed you on the first slide. Again, on the mandible. This is the ramus of the mandible, the angle. This is the mental foramen. Foramen is a hole, and it's usually for either blood vessels or nerves. The mental process. This is the alveolar margin. Alveolar has to do with teeth, and it's the margin where the teeth will attach. Here's the ramus. This is called the mandibular notch, right here. This is the condyle for the TMJ. And this is the coronoid process. And this is difficult to remember because we have also a coracoid process. We have a few coronoids and coracoids in the body. So you're just going to have to remember that. Nothing new on here. Nothing new at all. Same things. Okay, so superior view. We have the condyle. You can see here's the coronoid process here. Here's the condyle here. And the mental processes, that's your chin. Okay, moving down into the neck, on the anterior portion of the neck. This is for muscle attachment so you can swallow. This is the hyoid bone. You can see right here, hyoid bone. We're looking down on it. They call this the lesser horn here and the greater horn here and the body here. It's all you have to know. That will be on the exam, and you only have to learn 3 portions of it. So when we get to the ribs and the spinal cord, it's far more complex. So here's a great picture to study. Here's a vertebrae, and the ribs are only attached to thoracic vertebrae. That's an A. Attached to thoracic vertebrae. We're going to learn all these features of the vertebrae later. I wanted to show you here how the attachments of the ribs look on the vertebrae. You see this right here? This is a smooth spot, and it forms a demifacet for the head of the rib. It's a joint. This is actually a synovial joint right here. And so there's one also under here and one under here, and this will be for the next rib down. So there are 2 attachments on the rib head, and then there's an attachment back here underneath here. We'll show you later. This is the shaft of the rib. This is the costal cartilage. All of the ribs are attached to the sternum by these costal cartilages. Okay, here's a cross section of the rib. This is called the angle of the rib over here. This is the neck of the rib here. This is the head of the rib here. Head, neck, angle, body, shaft, body, whatever. Okay, not too difficult. There is a groove on the inside of the rib right here. This is for a vein, artery, and nerve, and you'll see that very obviously on your bones. So if we take a superior view, here's the body of a vertebrae right here. Okay, and these facets are going to articulate with the vertebrae above. These facets are going to articulate this one, and this one right here will articulate with the angle of the rib here. And here's our attachment to the demifacet right here. Okay, here's what it looks like. Here's the head. Remember, this is going to have 2 attachments to 2 different vertebrae. Here's a tubercle. And that's like, here's the neck of the neck. This is the shaft or body, and this is also the angle here. So all you need to know is the head, the neck, the tubercle, the shaft. This is always anterior. You can see it's very irregular because it's growing into cartilage, and then that'll go to the sternum. So here's what it looks like when it's all put together. Your ribs are attached at the vertebrae posteriorly, come around, they end right there. Here's the cartilage, and attached to the sternum. The sternum has a manubrium here. Manubrium. This is called, for some odd reason I'll never understand, the sternal angle. I just teach it. I didn't name them. This is all the body, and then the very tip is called the xiphoid process. And this is, I don't know why, because it's not a real joint. This is called the xiphosternal joint, but you don't need to know that. Okay? This whole thing is a sternum, so you need to know manubrium, sternal angle, and body, and xiphoid process. Okay? Of course, the area between the ribs is called intercostal spaces. You'll need to know that because there are muscles here, and there are the internal and external intercostal muscles, and they're responsible for respiration. So those are very, very important, and then we also use them for listening to the heart and the lung sounds. So again, on rib 1 up here, remember there are 12 per side, the cartilage is very small, and they get bigger and bigger and bigger and bigger. And you see each of these has its own attachment right to the sternum. But these, right here, they don't attach directly to the sternum. They attach to this rib's cartilage. And then the final two ribs are the floating ribs, 11 and 12. The false ribs are these 8 through 12 that don't have a direct connection to the sternum. And the true ribs are 1 through 7. Now just remember that. This is the costal margin. Now the diaphragm, this is so weird. The diaphragm, it has attachments down here. You know all this. It comes inside here and comes up and makes an indentation for the heart, and then up again like that. So, and then the heart, kind of like that. And then the lungs start way up here. And then they go way down here like that. Okay? Okay. So now I want to talk about the curves. First of all, we're going to talk about the areas in the spine. These are all artificially named. Someone noticed differences in the different vertebrae, so they named them differently. Cervical means neck. So those are the vertebrae of your neck, and there are 7 of those. 7. And they're called C1 through C7. The next section are the thoracic vertebrae, and there are 12 of those, and they're called T1 through T12. The next area is lumbar, and there are 5 of those, called L1 through L5, and then the sacrum, and this is 5 fused vertebrae. Okay, and then the coccyx is 3 to 5. Remember, everybody's different. Everybody's different. Everybody's different. So the sorry, the cervical curve is more. Boy, that was terrible. The cervical curve, I'm exaggerating. The thoracic curve, and the lumbar curve, and the sacral curve. It's like a spring, so that when you walk, the forces are transmitted into the spring, and it lightens the load on each of your discs, so that the spine will last longer. So the first one, they say concave, but it's what they call a lordotic curve. This one is called a kyphotic curve. So if it's exaggerated like this, Then they call it kyphosis. The lumbar curve is lordotic, and the sacral is kyphotic. Okay, that's just what they call them. I don't know why. Convex and concave, that's another way, but we usually use lordotic and kyphotic. Okay? So here's a spine. Up here is a vertebrae, right? This is the body of a vertebrae. This is the body of a vertebrae. And this is the intervertebral disc. You can say intervertebral disc. You can say it like that. In chiropractic, we have to use a lot of contractions like this so that, because we have to use them so often. So this is the lumbar spine. So this would be L5, L4, L3, L2. Okay? Right here are the intervertebral foramen for nerves to come and go into the spinal cord or out from the spinal cord. Here's one, and here's one. So you can see if you have a ruptured disc and this pushes out here, it can tickle this nerve here or compress it or completely squish it. And then you're going to have symptoms. And the symptoms can be motor or sensory, because this is a mixed nerve coming in here. So it can affect signals coming in or signals going out. So you can have like weakness if it's motor, or you can have pain if it's sensory. Ever have back pain or pain shooting down your leg, sciatica? That's how that happens. Now we're going backwards up to the sternum again. Good one. Here's the manubrium, right? This is actually called the jugular notch up here. I don't know why, because it's nowhere near the jugulars. These here are called costal notches. Sorry, and I promise you that's going to be on the exam. The xiphoid, since the xiphoid process is cartilage, it's not going to show here. Okay. Xiphoid. Alright, now we're going to get into the really nitty-gritty of vertebrae. And I'm going to have you make these out of Play-Doh so that you can really understand what's happening with these. Because all vertebrae start out as a circle, and then part of it will enlarge to be the body. This part is called the neural arch. And the neural arch has a lot of different structures on it. And the reason is simply to protect the spinal cord and for muscle attachments. Okay, so we're going to start off with the C1 vertebrae, the very, very top vertebrae. This one looks very different than 2 through 7. So these are very different. This is anterior up here, and this little knot, this little tiny process here is called an anterior tubercle. And in when you get to C3, that will be the vertebral body. Then right here, you'll have lateral masses, and these are facets to articulate with the skull. Lateral masses. And the mass, when they say mass, they're talking about this big chunk of bone right here. This is actually called a superior articular facet. Okay? Then we have transverse process here. Transverse foramen. Foramen's a hole, and this is for the vertebral artery. if you learn it now, you won't have to learn it later. Vertebral artery. That goes up to your brain, and it anastomoses with the carotid arteries to supply the base of the brain with blood. On the posterior side, we have a posterior tubercle. Remember, this is C1. It's going to be different than the other vertebrae. Now, the inferior view, here it's the inferior articulating facet or articular facet, right here. Again, the lateral masses, that's just this big chunk of bone here. Transverse process, transverse foramen, posterior tubercle, anterior tubercle. Now there is a facet right here, and this is for C2. C1 is also called, I'm sure you've heard this, atlas. And C2 is called the dens. Now you'll see in a moment, this is C2 here, dens. You need to know that C2 is the dens and that the dens is C2. The dens has this process right here. This is actually called the dens. I made a mistake. Sorry. Not the dens. It's the axis. Brain fart. Okay, axis. The dens here is going, this right here is going to live right here. So this facet right here will accommodate the facet that's going to be right here. Okay? And then when this is in here, there'll be a big strong ligament behind it to hold it in place so that your head doesn't fall off your spine. Again, superior articulating facet. Now, in this neural arch here, the space between these lateral masses here, okay, this again is transverse process, and the transverse process is called the pedicle. And the place between the transverse process and the spinous process is called the lamina. It'll be clearer in different vertebrae. So if we take a straight posterior view of a cervical, we have a spinous process. This is posterior. Those are the bumps you feel on your back. This is the body. Here's the superior articulating surface process. This is the lateral mass is now called an articular pillar. Okay, so the space between the lateral mass and the posterior mass is called the lamina. Right. Let's move on. This is a much better way to look at it. So here's the body, and the body is anterior. This is the spinous process. It's posterior. That's the bumps you feel on your back. The space between here and here is the lamina, and the space between here and here is the pedicle. That will definitely be on the exam, and you have to know it for every vertebrae. Pedicle. Transverse foramen, transverse process or TP. This is the SP, spinous process, and the vertebral foramen. Same thing. So cervical vertebrae are the smallest ones. As you go superiorward, they get smaller and smaller. You know what these are. Now when we get to the thoracic vertebrae, you can see more easily this is the pedicle. This area right in here is the lamina. So here, pedicle and lamina. You may have heard this word here. Really? Laminectomy. Sometimes when you have back pain and you have a ruptured disc, they'll do a laminectomy to let the pressure off of the exiting nerve. This is not a good picture to show it, but they'll just cut this area of the vertebrae out and decompress the nerve. So here's a lateral view of a lumbar vertebrae. As we go down, the lumbar vertebrae get more boxy. They're going to be quite large. This is the body. This is the pedicle here. This is the inferior notch. This is the superior notch. Superior articulating process and facet will be up here. This is the process. This entire thing here is the articular pillar. Okay? On the articular pillar, you have a superior articulating process. A process is something that grows outward. And here's the inferior articular process. And back here on the underside will be the inferior articulating facet, or IAF. And up here will be the superior articular facet. And a facet is a smooth spot to make a joint. So on the lumbar vertebrae, the spinous processes are boxy. Remember, on the thoracic, they're sharply downward and they look more like a knife. Like this. This is a thoracic. Very long spinous process. You can see them on your back, especially on a skinny person. Here's the articular facet for the rib head. Here's the superior articular process for the vertebrae above it, and it will look like that, and they'll come together. Okay? Pedicle, body. Here's the demifacet for the rib. Here's the other demifacet for the rib. Better when you see it in your hands. So here's the lamina, here's the pedicle, vertebral foramen, body, spinous process, transverse process. Again, you know all of this. So the disc has an annulus fibrosus around the edge, which is tough, fibrous connective tissue. And then it has a softer jelly center, which is also connective tissue, but it's more jelly-like, so it can absorb shock. And what happens is that wear and tear will break this down, and this will protrude out. And the nerve from the spine is coming out here. So it pushes into that nerve, and you either have pain or weakness in a limb. Okay, finally, we have the sacrum. And the sacrum has a few features. It has to articulate with L5, right? L5 is here. Oops, no, that's not good. L5 is right here, right? And it will have its inferior articular processes articulating with these superior articulating process of the sacrum. This is the base from edge to edge. This is the body, because this is the actual body of the fused vertebrae. This is a body, this is a body, this is a body, this is a body, right? Apex is a word we use for the sharp part of any triangle. Okay? And then this part is called the base. So it's just any triangle, no matter what it looks like in the body. This is the apex. Your heart has an apex and a base because it's roughly triangular. Here's your coccyx. This one has 1, 2, 3. You know, that might be 1, 2. These are called anterior or ventral sacral foramina. So you're going to have nerves coming out here. This is the posterior side, and this is where your spinous processes are. 1, 2, 3, 4, 5. This is called the median sacral crest because it's on the median line. These are the posterior or dorsal foramina. Here's your superior articulating facet. These are actually called the sacral ala. Ala means wing. And here's the coccyx down here. So, here's the ala, one on each side. Coccyx, sacral promontory, body, base. The sacral canal, you have to see it when you have it in your hands, is a space where the nerves from the end of the spinal cord enter and go inferiorwards. Here's your median sacral crest, this is posterior, and then your superior articulating facets are processed there. And that's it.